Let me start with a number that will make you question everything you know about your health insurance. 30%. Almost 1 in 3 emergency room visits gets flagged for a coverage review. And in many cases, the reason for denial comes down to a single hidden clause buried deep in your policy, one that insurance companies have perfected over decades. You think you are safe because you went to an in-network hospital. You think you are safe because you have good coverage. But that one clause has denied coverage to patients with chest pain, patients with severe abdominal pain, even patients who were later diagnosed with life-threatening conditions. By the time you finish this video, you will know what that clause is, why it exists, and exactly how to fight back. By the end of this video, you will understand the single most important legal protection you have never heard of. It is called the Prudent Layperson Standard, and it is the difference between a $200 copay and a $20,000 bill. I will break down exactly how this standard protects you, the one massive gap in the law that still leaves you exposed, and the step-by-step script to use if your insurance company tries to deny your emergency room claim. Whether you are in the US, the UK, or Canada, this video will give you the tools to protect yourself and your family from a surprise medical bill. Let me start with the history that explains everything. Before the Prudent Layperson Standard became law, insurance companies had a playbook. If you went to the emergency room, they would wait until after your visit, review your discharge papers, and then deny your claim if the final diagnosis was not a true emergency. Chest pains that turned out to be indigestion, denied. Severe headache that turned out to be a migraine, denied. That meant patients were being punished for being cautious, and people died because of it. They were afraid to go to the ER because they might be stuck with the bill. In 1997, after years of horror stories, Congress enacted the Prudent Layperson Standard. The standard says that insurance companies must base their coverage decision on the symptoms you had when you walked into the ER, not on the diagnosis you received after testing. In legal terms, an emergency medical condition is defined as a medical condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that a prudent layperson who possesses an average knowledge of health and medicine could reasonably expect that not receiving immediate medical attention would result in serious jeopardy to health, serious impairment to bodily functions, or serious dysfunction of any bodily organ or part. That is a mouthful. But here is what it means in plain English. If a reasonable person would have gone to the ER based on what you were feeling at the time, your insurance company must cover the visit. Period. They cannot second-guess you after the fact. They cannot deny coverage just because it turned out to be something minor. The law is on your side. But here is the pattern interrupt that most people never learn. Despite this federal protection, a poll from the American College of Emergency Physicians found that nearly half of all adults do not realize that their health insurer must cover the cost of going to the emergency department if they reasonably believe they are having a medical emergency. 7 out of 10 people worry their insurer will refuse to cover them. The Prudent Layperson Standard was designed to eliminate that fear. Yet almost no one knows it exists. Now let me talk about the hidden clause that still allows insurers to deny ER claims. Even with the Prudent Layperson Standard, insurance companies have found a loophole. They call it stabilization or post-stabilization care. Here is how it works. The law protects your initial ER visit, but once you are stabilized, insurance companies can argue that any further care is not an emergency. They will say you should have been transferred to an in-network facility or discharged to follow up with your primary care doctor. And if you receive out-of-network care after being stabilized, they may not cover it. In fact, under the No Surprises Act, which expanded protections in 2022, there are specific conditions where an out-of-network provider can actually ask you to sign a notice and consent form. By signing that form, you give up your billing protections. That is right. In the middle of a medical crisis, someone may hand you a piece of paper, and if you sign it, you could be agreeing to pay thousands of dollars out of pocket. Many hospitals have also challenged the enforcement of these surprise billing protections, creating a confusing legal landscape where providers fight insurers over payment while patients are caught in the middle. The No Surprises Act, which took effect on January 1, 2022, was a massive step forward. It protects you from surprise bills for emergency room visits, non-emergency care at in-network facilities, and air ambulance services. But here is the massive gap that no one tells you about. The law does not protect you from ground ambulance bills. If you take an ambulance to the hospital and that ambulance company is out of network, you can still be balance billed for thousands of dollars. Ground ambulances are not covered by federal surprise billing protections. Some states have stepped in. As of 2025, about 20 states have passed their own laws to protect patients from surprise ground ambulance bills, including New Hampshire, Texas, Utah, and North Dakota. But if you live in a state without such a law, you are on your own. Now let me give you a real-world example of how this plays out. A Colorado woman named Nicole Silva had her 4-year-old daughter in a car crash. The daughter needed a ground ambulance to a local hospital, an air ambulance to Denver, and another ground ambulance to a children's hospital. The daughter was on Medicaid, which was supposed to cover everything. But one ambulance company billed her for over $2,000, sent the bill to collections, garnished her wages, and added court fees and interest. She was a preschool teacher. She could not pay. Her family fell behind on their house payment, their electric bill, and buying food for their kids, all because of a bill she never should have received. Now, let me walk you through the exact steps to fight an ER claim denial. Step 1. Know your rights. The prudent layperson standard is your shield. If your insurance company denies your ER claim, ask them in writing to explain how their decision complies with the prudent layperson standard. Step 2. Do not sign any notice and consent form in the ER. If a provider asks you to sign something, ask what it is. If it waives your billing protections, do not sign it. You have the right to refuse. Step 3. If you receive a surprise bill, contact your insurance company first. Under the No Surprises Act, your insurer must process out-of-network emergency claims at the in-network rate. If they do not, file a complaint with your state insurance commissioner. Step 4. If the bill is for a ground ambulance, check your state laws. Some states have protections. If your state does not, call the ambulance company and ask for a financial assistance application. Many have charity care policies that can reduce or eliminate your bill. Step 5. If all else fails, contact a patient advocacy group or a consumer attorney. Many offer free consultations. Let me also address the UK and Canada because the rules are completely different. In the UK, private health insurance typically does not cover emergency medical treatment. If you have a medical emergency, you are expected to call 999 or go to the nearest NHS accident and emergency department. Private insurance is designed for planned, non-emergency care. The NHS is free at the point of use for all residents, regardless of insurance status. So if you have a heart attack or a car accident, your private insurance is not your first line of defense. The NHS is. However, once you are stabilized, some private policies will cover your transfer to a private hospital or a private room. The key is to understand that emergency services are fundamentally different in the UK. Private insurers are not required to cover them, and most do not. The biggest risk in the UK is not emergency care denial, it is pre-authorization failure. For non-emergency treatment, you must get pre-authorization from your insurer before you receive any care. Failure to do so is one of the most common reasons for claim denials. If you need private treatment, you must contact your insurer first. They will verify that the treatment is medically necessary and falls within your policy. Without that approval, you could be left with the full bill. If your claim is denied, you can appeal through the insurer's complaints process and escalate to the Financial Ombudsman Service, a free service that can overturn the insurer's decision. In Canada, the situation is different again. Provincial health plans like OHIP in Ontario, MSP in British Columbia, and AHIP in Alberta cover emergency medical services for residents. If you need emergency care within your province, you are covered. Your provincial health card is all you need. But the gap is massive when you travel outside your home province, especially to the United States. Ontario residents are told repeatedly that OHIP covers out-of-country emergency services only in very limited circumstances. Emergency circumstances are defined as medical circumstances in which a person faces an immediate risk of death or medically significant irreversible tissue damage. Even then, you must meet strict criteria, and in most cases, you are responsible for the upfront costs. One Ontario senior named Myra Nelson traveled to Florida. She had a cardiac arrest and was hospitalized for 2 weeks. She had purchased travel medical insurance. Her claim was denied because she had a kidney condition that she did not mention on her application, even though she takes no medication for it. She is now facing a bill of more than $290,000. Another Ontario resident, Rose Ann Timbrell, went to Florida, fell ill, and was diagnosed with ovarian cancer. She called her insurer before going to the hospital and was told she was covered. Months later, her claim was denied because of a stability clause in her policy, arguing that her illness was linked to a pre-existing condition that had not been stable for 90 days before her trip. She is now facing a $65,000 hospital bill. The lesson is harsh. If you are Canadian and travel outside your province, do not rely on your provincial health plan. Do not rely on your employer's extended health plan. You need standalone travel medical insurance, and when you apply, you must disclose every single health condition, no matter how minor, and you must read the fine print about stability clauses and pre-existing condition exclusions. Let me recap the key takeaways. Number 1, the prudent layperson standard is a federal law that requires insurers to cover ER visits based on your symptoms, not your final diagnosis. You have this protection. Use it. Number 2, nearly half of all adults do not know they have this right. Spread the word. Number 3, the No Surprises Act protects you from surprise out-of-network bills for emergency room visits, but it does not cover ground ambulances. 20 states have passed their own ground ambulance protections. Check your state laws. Number 4, in the UK, private insurance does not cover emergency care. Use the NHS for emergencies. For non-emergency care, always get pre-authorization before treatment. In Canada, your provincial health plan covers emergency care within your province. Outside your province, especially outside Canada, you must have standalone travel medical insurance. Disclose all health conditions. Read every word of your policy. Number 6, if your claim is denied, appeal. In the US, contact your state insurance commissioner. In the UK, contact the Financial Ombudsman Service. In Canada, each province has its own appeals process. Number 7, never sign a notice and consent form in the ER without reading it carefully. If it waives your billing protections, do not sign it. Number 8. The best defense is knowledge. Know your rights before you need them. Here is what I want you to do right now. Open your health insurance app or pull out your policy documents. Search for the words emergency services or prudent layperson. If you cannot find them, call your insurer and ask for a written explanation of how they comply with the prudent layperson standard. That one question will tell you everything you need to know about whether your insurer is playing by the rules. If this video helped you understand your rights in an emergency, hit the like button. It helps more people learn the law before they face a surprise bill. Subscribe and turn on notifications so you do not miss my next video, which is called The One Phrase That Forces Your Insurance Company to Pay Your Emergency Room Bill. And comment below. Have you ever had an emergency room claim denied? What happened? Share your story and your country. I read every single comment. Thanks for watching. Now go protect your rights. See you in the next one.